into the changes to the risk model for payment year 19. And payment year 19 is a blend. It is a blend of two models. The model we are all used to, which is referred to as the 2017 model or version 22. On the top, this is pretty self-explanatory. They've increased the normalization factor. The coding intensity factor is 5.9%. And for payment year 19, using the 2017 model, the data source will be RAPS and fee-for-service data. So for payment year 28, for this current payment year, we're using model 22, but it's using RAPS, fee-for-service, and EDPS and fee-for-service. So there's going to be a key theme throughout the presentation, and that has to do with the data source and the payment model. So the first time I read the call letter, it wasn't immediately apparent that this would be like the first initial transition away from RAPS to EDPS as the sole data source. And again, as we move through this, you're going to see more detail and specifics about what I'm referring to. So for 2019, it's going to be using the 2017 model or version 22, and then it is also going to blend with that the new model, which is referred to as the 2019 model or version 23. So we have, again, different normalization and coding factor. Coding intensity is the same because it's the coding in the same year. The key thing is that the model, so the V23 model, will only use EDPS and fee-for-service from all sites of service and inpatient RAPS only. So that's key, inpatient RAPS only. CMS in the advance notice was trying to decide between two multiple condition models. While they did pick one, they are not going to implement it in 2019. On the right of the slide, you can see some new disease conditions, 3 categories: substance abuse, mental health, and chronic kidney disease. Now, there is a massive spotlight on opiate abuse, and that has become a focus for a lot of health plans. And in HCC under mental health, HCC 59, the doctor must use the word major in the documentation for it to be coded and rolled into HCC 59. That's not new, but I just wanted to point that out. A lot of times people will put depression and it gets incorrectly coded as major depression. Unless the physician states major, it cannot be coded as major depression. The model version 22 has been recalibrated using they were using updated data to calibrate. They're going to use claims 2012 through 2016, updated with the 2018 indices for wages and geographic practice costs.